Good afternoon, everybody. For those who I do not know, my name is Sandra Enriquez, and I have the privilege of serving as Dean of the Boston University School of Public Health. On behalf of our school, welcome. Before we begin, a word of thanks to our co-host, the Boston University Initiative on Cities. Thank you in particular to the intellectual leads for the day, Professors Patricia Fabian and Professor David Jernigan. And thank you to Meredith Brown and Alicia Noel in the Dean's office who set up these events. These events are public health conversations. They are spaces where our community comes together to discuss issues of concern to health. At each event, we learn from speakers who help guide our thinking about issues at hand. Thank you to everybody in the audience who joins today's conversation. This year is the 45th anniversary of the Boston University School of Public Health. To mark this anniversary, we have chosen to elevate the theme, Public Health, Now is the Time. Each month, we are highlighting our school's areas of interest. This month's focus is Cities and Health, Now is the Time. This is a topic our school cares about quite a bit. It's for this reason that we've included Cities and Health as a strategic direction in our school's strategic plan, and today's event reflects an extension of this focus. We know that health is deeply influenced by our physical environment. Where we live, work, and play shapes our daily exposures and our access to the resources that generate health. With 2/3 of the world's population expected to live in cities by 2050, how we design cities will become ever more central to how healthy we can be. Throughout history, disease has shaped the design of urban spaces. Cholera informed the development of sewage systems and the use of modern street grids. Zoning laws were designed in part to prevent crowding, which can spread disease. During COVID-19, we saw many modifications to the built environment meant to help slow the spread of disease. The lessons of the moment can help us think better about shaping healthier cities. Today, we are going to discuss how we can apply these lessons to building healthy, sustainable, and resilient cities in a post-COVID world. It's now my great pleasure to turn the screen over to Cheryl Duvall, the moderator of today's event. Cheryl Duvall is a veteran storyteller in sound, images, and words. She has reported and edited with National Public Radio and for newspapers in Boston, Chicago, and Opelousas, Louisiana, the birthplace of Zydeco music. Cheryl has worked on nationally distributed public radio programs and public stations throughout the United States. We are really honored to have Cheryl with us. Cheryl, over to you.
Thank you, Dean Galea, and good afternoon to all of you who are joining us. As parts of the country reopen after COVID-19, I wonder a lot about what we'll retain, what we've learned, and what we may continue to learn from having lived through this experience. And in that spirit, I'm so honored to introduce the panel and to keep an eye on your questions when it's time to do that. A year and 3 months ago, it's hard to imagine that we would be here. And we're going to hear first from someone who was in the thick of it when the rest of the country looked on. Dr. Osiris Barbeau is a physician, and she was in charge of public health in New York City during some of the most challenging and painful moments of the COVID-19 infection. And she brought her expertise in public health and healthcare delivery, along with a real commitment to racial justice. Right now, she's a senior fellow for public health and social justice at the JPB Foundation, and also an adjunct assistant professor at the Columbia University Mailman School of Public Health. So we will be hearing from her first. I'd like to introduce the other panelists in the order in which we'll be talking with or listening to them. Ms. Katrina Forrest is a government relations expert. She's also very fluent in policy development and partnerships. And she is a co-CEO of City Health. And that is an organization that charts the the health status of the 40 largest cities in the United States and tries to promote healthier ways of living through multiple indicators, including access to green space, absence of tobacco, and so many other factors. And she will be talking with us some more based on her experience at City Health and also as a lawmaker, active in the staff of at-large Washington, D.C. Council Member David Grosso. And she was responsible for drafting more than 50 pieces of legislation and leveraging community partnerships to drive the council members' agenda. Then we'll meet Dr. Diana Hernandez. She's an associate professor also at the Columbia Mailman School of Public Health, and she is a principal or co-investigator on several projects in the South Bronx, where she's from, where she lives now, related to structural interventions in low-income housing. And she focuses on alleviating the consequences of poverty on health and really pays attention to where the disparities fall and figuring out ways to mitigate that. And our final panelist this afternoon will be Ms. Sandra Enriquez, Chief Executive Officer of the Detroit Housing Commission. She directs all the commission's administration and operation, and she's responsible for upgrading and repositioning its present portfolio of properties and developing new and integrated holistic approaches to housing to ensure that housing is a platform upon which people can build their lives. She's also charged with the creation of more affordable housing through development, construction, property management, and she has taken what she knows from the Obama White House to the city of Detroit. They're all going to share some really valuable insights, and I'd like to turn it over to Dr. Barbeau first. Each speaker will talk in turn, then we'll discuss among ourselves, and there will be time for questions from all of you. So please feel free to type your questions into the chat. Dr. Barbeau, the floor is yours, or the screen is yours.
Thank you, Cheryl. And it's a pleasure to share the screen with such a dynamic group of speakers. Today, my colleagues and I are going to be talking about ways in which COVID has highlighted the degree to which cities can support health and what we can do moving forward to have more livable and just cities. Today, I'm going to take my talk in a little bit of a different direction than I normally take, and I'm going to likely raise more questions for the field than provide answers. Excuse me. And I've been thinking a lot about what makes a city and how public health can best situate itself to promote and protect the health of city residents. And so to begin with, the question is, what is it about a city that makes it that city? Said differently, what makes Boston, Boston, and New York City, other than our ongoing baseball rivalry? And how can a city continue to be that city post-COVID, but just more intentional about health and equity? And said slightly differently, how can a city's vibe or its secret sauce be more public health informed? And how can public health more intentionally alter a city's culture to support health in a way that promotes self-sustaining activity? And so to begin with, I think it's important to note that from my perspective, and obviously I'm not a city planner, there are two things that define a city from a public health perspective, and that is density, and two is how individuals and communities interact with each other and institutions within that density. And the secret sauce of the city isn't so secret after all, because we know that it's the people. And so the interaction between communities and institutions, such as public health departments, transportation departments, schools, etc., has a culture all its own that too often is driven by, quote, the isms blinders, as I call them, like racism, sexism, classism, ableism, that influence decision-making around resource allocation that then hinder our ability to get better health outcomes faster. And on top of that, we work in silos despite the fact that people don't live in silos. And so this moment in history is an opportunity for us in public health to accelerate changing the culture of isms blinders to a culture of positive drivers for better health outcomes faster. And so one of the most powerful positive drivers is the degree to which there is connectedness in a community. As more and more restrictions are lifted, the life we see on this street, I live in Brooklyn and it's hopping, right? The life we're seeing on the street reflects a pent-up demand for human connection after such a prolonged period of isolation and physical distancing. And we need to capitalize on this opportunity to convert potentially random or transactional interactions into purposeful ones that spark engagement and connectedness. And I choose the word connectedness instead of social cohesion on purpose. Connectedness for me gets the public to the value I think we should be promoting much faster than social cohesion, even though in many circles, they can be used interchangeably. And so that then gets me to the two challenges in talking about this concept. One is agreeing on the definition, and two is how to measure it at the population level. So I'm not going to spend time summarizing the debate in the public health literature or the social sciences literature around the definition of social cohesion, other than to share one that stands out for me from a scholar at the European Institute for Gender Equality. And Anna Manka, the scholar, notes, social cohesion is a social process which aims to bring people together, and I'm paraphrasing, which aims to bring people together by reducing inequality and socioeconomic disparities and fractures in society. It reflects people's needs for both personal development and a sense of belonging, and links together individual freedom and social justice, economic efficiency, and the fair sharing of resources. And so the other sort of challenge that I mentioned, I'm not going to spend a lot of time on, other than it's been, I think, an obsession of mine for the last 10 years. The long and the short of it is that beyond Sampson's series of questions that get to the more public safety related aspects of community connectedness, there's a dearth of validated questions that get to the issue of measuring connectedness in multicultural cities. And we've brought scholars together from various disciplines to help us, when I was at the health department in New York City, to get to the point where we could actually field and validate questions. So if for the researchers out in the audience, if you've got ideas, if you've got suggestions, please do send them my way. But getting back to Manka's definition, in order to get to that dynamic state, we need to help people heal, reintegrate by connecting to others, because this past year and a half, it's been defined by new traumas on top of old traumas, and there's only so much healing that can be done in solitary mode, as we've learned from Van der Kolk's book, The Body Keeps the Score. And that interplay between connecting and healing, the more connecting you do, the more healing, the more healing, the more connecting, that interplay then becomes a virtuous cycle for the individual and those around them. And these individual benefits then should accrue at the community level, so that as more individuals with the capacity to connect meaningfully increases, so does the likelihood of solidarity, collective action, and community resiliency. So why is this important? Well, it's been important for a long time, but COVID reminds us that pandemics are the ultimate in collective problems that require collective solutions. And I think many of us would agree that the way in which the United States has handled this is a great example of the consequences of not having collective response. And so recently, there have been several interesting studies that have been published on examining the influence of individualism and collectivism on COVID outcomes at the country levels. And to summarize their findings, among the most relevant covariates, accustomed freedom of assembly and association and agency were found to be associated with increased COVID-19 transmission speed, and the countries where with more individualistic cultures had more cases and deaths. And there was one study in particular that conducted state and county level analysis in the United States and found that states and counties with increased collectivism saw higher mask use, even when you controlled for demographic variables, COVID-19 severity, government stringency, meaning how aggressive were local governments in instituting distancing measures and other non-pharmaceutical interventions. Also, when you controlled for population density, income per capita, and most importantly, when you controlled for political affiliation, which kind of goes counter to this narrative that we've been hearing in the media. And so, as I wrap up, I just want to say that urban public health has an opportunity to influence how our country heals from this tragedy by using the power of life experience to highlight shared experiences, build bridges, and strengthen bonds to foster solidarity and collectivism that best situates our cities for weathering this and any subsequent disaster. This approach can pay dividends not only in health outcomes, but in the myriad ways in which our communities define their vitality. But there are obvious obstacles to be overcome. One of the biggest challenges is changing our culture around the way in which we deal or talk about trauma, or just talk about our emotions, period, right? Although within that particular aspect, I think there are changing generational components that we can also talk about. And so overall, I think we need a coherent public mental health system, one that focuses on helping people develop their emotional literacy and fostering mental wellness instead of what we currently have, which is a patchwork more likely to medicalize, pathologize, or criminalize normal reactions to abnormal events. And honestly, I wish I had a slew of programs to recommend or highlight, but I don't. This is an area where there is much work that needs to be done. And if folks in the audience have examples, again, I encourage them to send them through the chat. And lastly, this pandemic isn't over, and it's anyone's guess as to when it will end. What we know won't end anytime soon are the non-visible blows that we've all sustained. And as more people take to the outdoors, we need to focus our efforts on helping people in communities connect and organically construct dynamic ways to develop collective resiliency against potentially traumatizing events, be they natural or man-made. And talking about policies, the built environment, housing are all ways in which we can get to that. It's our time in public health to go big on culture change around mental wellness as a way to influence positive drivers of wellness, overall wellness, and vitality in cities. So I want to thank you for giving me this opportunity. I look forward to a vigorous and rigorous and dynamic question and answer period. And now I want to hand it back over to Cheryl.
Well, thank you, Dr. Barbeau. And that's so much to think about. And I'm also eager to engage you all in the conversation between now and the Q&A. I'm going to turn it over to Ms. Katrina Forrest of City Health. It's all yours.
Thank you, Cheryl, and good afternoon, everyone. As was mentioned, my name is Katrina Forrest, and I am the co-executive director of the City Health Initiative. And bear with me, I am the only millennial that is probably tech unsavvy, but I'm going to try to share my screen. Okay. I am going to kick off my presentation with a very brief overview of who we are at City Health and how we work. Okay, so City Health is an initiative of the De Beaumont Foundation and Kaiser Permanente, and we advance a package of 9 evidence-based policy solutions with the potential to boost health, well-being, quality of life by addressing key social determinants. Currently, we assess the nation's 40 largest cities based on the number and strength of the policies they have in place. We then award those cities on an annual basis, gold, silver, bronze, or no medals in each of our policy categories, as well as an overall medal. And then we support our cities, those cities that seek to advance and adopt the policies within our package. We support them through the provision of technical assistance, key message development, and more. On the next slide, you will see our full list of policies. And in the interest of time, I'm not going to go through all of these, but because we are focused on the social determinants, we look at everything from housing to transportation to education. So how do we award our cities medals? To earn an overall medal, to earn an overall gold medal, I should say, cities need to receive 5 or more individual gold medals. To earn an overall silver, they need to earn 5 or more individual gold or silver medals. And to earn a bronze, cities need to receive 4 or more individual gold, silver, or bronze medals. And so that is City Health in a nutshell. I'm happy to take questions at the end about how we work, but want to get to more about COVID and cities and where we go from here. So in terms of COVID's impact on cities, it is very much unfolding in real time. While we are emerging, I don't think we're yet on the other side of this pandemic. And I'm not sure that the magnitude of this moment is going to be fully known or understood for many years to come. But I will say for me personally, COVID has been marked by immense loss, whether it has been the loss of our routines or the experience of losing a loved one. We have all lost something. And I focus on that collective we for something that Dr. Barbeau mentioned, because I don't think that we can talk about cities in isolation of the people who inhabit them. Cities are economic centers. They are hubs of innovation and creativity and cultural vibrancy because of the people who live and work there. And I think we have to bring that human frame to these issues, because when we talk about how do we come back stronger and more resilient, it really does start with prioritizing people. But for the purpose of this presentation and thinking about COVID's impact on cities and the city ecosystem, I think COVID absolutely laid bare a number of health disparities. It exacerbated some longstanding inequities. COVID also decimated certain workforce sectors, with hospitality and retail suffering particularly hard hits. And the effect of that was that cities did see their tax revenues diminished, which placed significant pressures and burdens on local budgets. I could go on and on and on about the innumerable ways that COVID indelibly changed our world. But I think we have learned and are continuing to learn so much about our interconnectedness, going back to that word that Dr. Barbeau talked about. But for this presentation, I want to focus on 3 key learnings. These learnings, I think, also provide a blueprint for where we go next and how we come back stronger and healthier and more resilient. So I want to start my presentation by really praising city leaders and praising their resilience, and then focusing on innovation, focusing on the importance of centering equity, focusing on the importance of policy. And then I want to end talking about the toll that this pandemic has taken on city leadership. So on city resilience, no surprise here, cities were extraordinarily resilient. And I had mentioned at City Health, we assess cities based on the number and strength of the policies that they have. And in 2019, 75% of our cities earned an overall medal, but that number increased to 90% in 2020, which is remarkable when you think about all that was happening in that year. And I think I really can't say enough about the resilience of city leadership and the power of strong city leadership, because we are talking about folks who were called to do more with fewer resources in a politically polarized climate, and yet they hunkered down and got it done, and they were able to pass some strong public health policies. These are our 2020 overall medals. Again, I'm not going to go through all of these, but in 2020, we had 10 gold medal cities, 12 silver medal cities, and 14 bronze medal cities. The other learning, which I can't say that we have learned through COVID, perhaps COVID has helped to reinforce that innovation is an absolute necessity for sustained growth and prosperity. The normal in which we were existing is very much a part of the problem. And I think if we are to come out on the other side, we have to create the space for city leaders to innovate and be creative. And they did that. As COVID's unprecedented challenges were unfolding, city leaders were adaptive and they did innovate. These examples that are on this screen, they're not endorsements of City Health, but I think it's important to highlight some of the thinking of how cities were tackling some of our most intractable problems. So I will surface a few of these. When faced with a pressing affordable housing challenge, the city of Minneapolis became the first major city in the US to implement a ban on single-family zoning in every neighborhood. When you think about the self-isolation as a result of stay-at-home orders and the depression and stress that that created for people, you had cities like New York and Los Angeles step up to reimagine their provision of mental health services. When you think about what was happening culturally, you had cities like Seattle and Louisville who tackled police violence and police brutality head on by passing strong reform bills where they banned practices like the execution of no-knock warrants. Innovation is key if we are to come back stronger. The other lesson that I think COVID has taught us is really the importance of policy. From City Health's perspective and sort of a 30,000-foot view, what we saw is that cities that had strong policies already in place were far better prepared to withstand some of the blows dealt by COVID. And I think a really good example of that is earned sick leave. Pre-COVID, earned sick leave was probably a little bit politically divisive. Post-COVID, you had cities and states scrambling to get this policy in place so that their residents weren't forced to make the tough decision of showing up to work sick and potentially exposing people to illness, or staying home and not having the ability to pay their bills. So policy is very important. And it is, again, one of those building blocks that we need to have if we're to think about how to come back better on the other side. The other really important lesson that we have learned through COVID is the importance of centering equity. And city leaders became acutely aware of the importance of centering equity, something that those within public health and other sectors have known for a long time. But when you think about who bore the largest share of the COVID-19 burden, it was disproportionately and overwhelmingly people of color. And then when you layer on what was happening in context in the world, you had the calls against police violence and police brutality, the movement for racial justice. City leaders found themselves squarely in the center of that. And they were forced to grapple with some extremely uncomfortable truths about inequity and the role of race and racism. And so if we are to prevent health disparities from further widening and ultimately work to close these gaps, we have to be intentional about setting an equity-focused and equity-forward agenda and taking a multidisciplinary cross-sector approach. It is going to be critical to building back stronger, healthier, and more resilient communities. Finally, on the toll of COVID on leadership, I've just talked about this confluence of crises. We had the COVID-19 pandemic, the movement for racial justice, and city leaders were very much at the forefront of that. And many of them expressed deep anxiety about the economic toll that COVID had taken, as well as some other factors. And what we're seeing now is that a number of city leaders, a number of health officials have decided enough is enough. This is too much, and they are exiting public life. I raise this because I don't think these exits are inconsequential. With them comes the loss of continuity, and as we are working to rebuild, that is significant. It also comes in some cases with a loss of deep institutional knowledge, where you might have had a long-term mayor who was 4-term or more decide that now is the time to walk away. That is very challenging. That said, it does create a new pathway for fresh energy and new vision as we move forward. So where then do we go from here? It's much of what I've just talked about. It starts with prioritizing people. It starts with making sure that city leaders are advancing strong evidence-based policy solutions, that they are creating climates where innovation and creativity can flourish, and where they are advancing and adopting an equity-focused, equity-forward agenda to make sure that everyone is being uplifted as we start to try to rebuild. I also think cities have an incredibly rich opportunity to really reimagine what it means to live in a city now that there has been this influx of federal dollars thanks to the American Rescue Plan Act. And if I was a betting person, which I am not, I think you're going to see cities make historic investments in things like housing and homeless services. I think you are going to see cities become far more aggressive in their climate change efforts. I think you're going to see them work tirelessly to attract new businesses and talent and retain them. I think you're going to see them really prioritizing equity. We've already started seeing this with the creation of offices on equity and hiring chief equity officers. We have an incredible opportunity to reimagine a world that is better for all of us, and that is different, and that is stronger, and that is healthier. And I'm excited about the possibilities. On City Health side, we have a lot of new happening as well. We are being far more intentional about centering equity squarely within our policy criteria. In 2022, we are going to be expanding our policy package. And we are also going to be expanding our city footprint, moving from assessing the largest 40 cities to the largest 75. So I am going to end there and pass it back over to Cheryl, but really look forward to the conversation to follow. Thank you.
Thank you so much, Ms. Forrest. I look forward to inhabiting that better world that you seek. Shall we get there? Dr. Hernandez, I am happy to reintroduce you rather, and I'm going to allow you to take us to the Bronx.
Happy to be your tour guide. Very grateful to be here. Thank you, Cheryl, and to the other panelists and the organizers of this event. It's always a delight for me to kind of share the insights of my muse, that is the Bronx, New York. In some ways, everything that I know and do with respect to poverty and public health is very much inspired by this place. And so I'm going to just start with an op-ed that I wrote in March of 2020, and it was basically a call for the survival of my neighbors. In many ways, I saw it coming. It was very obvious that the social determinants of health might render a place like the Bronx that much more kind of disparately impacted by the pandemic. Wasn't clear the scope and scale of the pandemic at that point, but it was really obvious from having experienced the deadliest outbreak of Legionnaires in 2015 that in fact it was the fact that the Bronx has the sickest people in New York State, that there was the underlying conditions that were really the cause for the disproportionate death in Legionnaires. And this is just an example within a 5-year period of very deadly outbreaks impacting a vulnerable population by virtue of deep poverty as well as health disparities. I'm just going to run through some really kind of brief indicators of the impact. So the Bronx had the highest rate of death in New York City. If we just look at it by race, ethnicity, Latinos and African Americans were disproportionately impacted by COVID in New York City in terms of hospitalizations and severe illness. By poverty levels, the poorest populations in New York City were disproportionately impacted. So as I kind of consider the question around coming back better, and that subtitle around building healthy, sustainable, and resilient cities in the post-COVID era, I think about, or I'm calling upon the great philosopher Susie Orman, because of course she knows how to live a good life, right? I mean, we basically want a little bit of that. You know, if I just think about what she thinks of as financial security, the basis for financial security, it's about being able to, on a regular basis, meet your basic needs and also put away a little in case of an emergency. And many of us would absolutely render COVID-19 or, for instance, a hurricane or some other kind of extreme weather event, a certain emergency. And by now, many of the households and the families and the people that we're concerned about as we think about building back better have really expended their reserves, their resilience reserves. In fact, when we think about resilience, maybe a better way for thinking about the alternative to resilience is in fact security. And so my grandmother always told me to save my pennies. It was the way that for sure I would be more secure. And so I'm going to kind of turn this around and think about coming back better as an opportunity for investing in security, and investing in security in 5 particular ways: in health security, in economic and material security, in safety and security, environmental security, and residential and social security. And let me go through those quickly. So underlying the kind of disparate impact and acute outcomes, that of hospitalizations and deaths among not just people in New York City, but worldwide, and especially in the United States, are hypertension, so chronic illness, hypertension, disease, and obesity. And there are great disparities in the experience of hypertension, disease, and obesity in a city like New York City, where in the Bronx you have a 2.5 to 8 times higher prevalence of these 3 conditions than you do in a high income, low poverty neighborhood like the Financial District, Greenwich Village, or Soho. And so the other side of that is really to develop opportunities for people to access health, not just health care and access to insurance, but certainly opportunities for living a healthy life, which have a lot to do with mental health, as was described before, but also physical activity and eating well, kind of healthy food access, which I'll get to more momentarily. But let's just talk about the kind of social and economic determinants of health. One of the kind of really obvious impacts of COVID were that it reaped havoc and exposed and exacerbated the existing inequalities that we are all kind of interested in. And so in New York City, a white and higher income households were much more likely to be able to work from home, whereas Black New Yorkers were disproportionately impacted by job loss. This is an example of, or this is a kind of a reporting out of New York City residents who had experienced a loss of income. And what you see is that Hispanic and Latinx populations, as well as those that are earning less than $35,000 were, disproportionately impacted. But also thinking about the financial hardship. So if we just disentangle what poverty actually is, then we can appreciate that it's sometimes about the inability to pay rent, or to pay for gas, oil, or electricity bills, to pay for phone or internet bills, afford subway and bus transportation, as well as afford groceries. And Latinos and Black New Yorkers are 1.3 to 2 times more likely than white New Yorkers that have reported having those material hardships. So in building back better, we should be focusing on food security. Households that had experienced an economic or income loss during COVID were also more likely to report experiencing food insecurity and having to resort to food pantries. So as we move forward, we should be improving access to healthy food, mindful of cost and quality. And I'll get to this question of residential security shortly, but just keep in mind that if there's a Whole Foods in a previously low-income neighborhood that comes in, and not to necessarily zero in on that on Whole Foods, but just to think about the importance of being able to afford high quality food, and as well as to access it. The other point of security is housing security. And not just housing security. So there's clearly a huge homelessness problem that has unfolded as a result of COVID, and has also made it more apparent because, homelessness, when it comes to street homelessness, is something that is more obvious and visible. But these are different dimensions of housing that are also important: cost, conditions, and consistency. So there are clarion calls around affordability, and the need for affordable housing, not just to build it, to preserve it as well. So also improve the conditions of housing. Public housing, for instance, has a maintenance problem, a huge issue in terms of deferred maintenance that has rendered affordable housing almost unlivable because of its conditions. And so in building back better, we have to focus on improving housing conditions, and also contend with the idea of, is it morally okay to evict people for non-payment, for instance? And so now we are kind of up against these moral questions and the decisions around whether or not to continue to protect people's homes and their ability to stay in their homes via eviction moratoriums. Is that something that we can kind of implement long term? Same thing around utility shutoffs. A big part of my research has been around energy insecurity, defining that problem, and also thinking about what are the kind of aspects of energy insecurity that affect health. And so absolutely thinking about whether or not shutoff moratoriums can also stay in place, but also maybe reimagining how people access power, how they access utilities in the form of gas and electricity and oil. One of the other kind of pieces that was made evident by the COVID pandemic was the digital divide, this kind of long-standing problem that hasn't yet been resolved. And all of a sudden we understood that because children were learning from their cell phones. And what is obvious now is that there are educational losses as a result of this, and that a whole generation of children will be affected by the kind of academic gap that was COVID. But some of that also really rooted in the inability to access and to connect to remote classes as a result of not having access to broadband. So we'll have to reimagine what that looks like, also in terms of telecommunications and access to phone services. And also water. Flint was a really important example in terms of thinking about water quality. As we build back, that has to be centered, but also thinking about water affordability, especially for homeowners, and whether or not access to affordable and clean water is a human right. Again, these kind of moral questions that we must contend with in building back. Let's talk about safety and security. These are actual images from the last few days where there was a shooting involving 2 children that got tangled up in the context of a daytime shooting here in the Bronx. This is something that is happening not just in New York City, but in cities around the United States, where violence is yet again kind of an evident epidemic that we must deal with. And at the same time, the arbiters of safety essentially could be the police, except that they're also some at the hands of violence in communities. And so how do we improve police-community relations in ways that allow for police to offer the important service that they do provide in terms of dealing with any number of conditions that police officers deal with, at the same time offering the sense of safety that residents deserve. Then there's environmental security, thinking about air quality, extreme weather and nature and green space. So this is a picture that comes from a news article that was covered in the Bronx, and there was a correlation between air quality and COVID acute outcomes, hospitalizations and deaths. And at the same time, there are ideas about how to improve air quality in communities like this one by capping the Cross Bronx Expressway, for instance, as a way of not just reducing the air pollution, but also providing a physical reconnectivity of the community by kind of undoing the legacy of the Robert Moses era. Then there's extreme weather. Many of us right now are kind of relying on air conditioning, and yet there are many households around the United States that don't have air conditioning and cannot have relief from extreme heat. And so that is another area in thinking about home-based infrastructure that we might have to consider in building back better. And that also includes resilient power, so battery storage options, so that people have access to uninterrupted power in the context of a power outage. There's certainly the opportunities for green space and connecting to nature. This is a rendering of a waterfront, a reimagined waterfront. Of course, the legacy environmental hazards in the background, but certainly the opportunity to maybe reimagine and enjoy aspects of the community like the waterfront in the Bronx. This is a rendering that was done precisely from community members. And so as I end on this kind of idea of residential and social security, it's the idea that all communities should be vibrant and hopping and popping, and that many of them are, but they do so in spite of the many challenges that they face. And I certainly kind of feel that and experience that in the Bronx. And I'm so happy that Dr. Barbeau kind of mentioned social connectedness. That's also how I think about it. It's about being able to enjoy these communities that are revitalized and reinvested in and redeveloped, not for the purposes of somebody else coming in, but in fact, so that current residents are actually able to enjoy those improvements, that the policies that allow for the preservation of the people in those communities are forefronted. And so much like Katrina mentioned, that equity be centered, but that the possibilities that people are able to enjoy those investments are really kind of front and center. And so with that, I'll hand it back to Cheryl. Thank you.
I'm sorry, I can't right now. Hello. Sorry, the doorbell rang.
That's right.
That happens. We all
Sorry,
are working from home. Thank you so much, Dr. Hernandez. And
You're welcome. I'm trying to get out of this. Sorry.
I beg your pardon?
Okay.
Okay. And so we're going to travel back east again to hear from Ms. Sandra Brooks and Enriquez about just what role housing can play in the health of a community.
Well, thank you very much, Cheryl, and to all of my colleagues. It's a pleasure to be here. I want to talk a little bit from my perspective, since I'm a practitioner. I build, develop, renovate housing, and think about housing and how it's situated in community and how people live in community. For many years, I saw myself as only a housing person. That's all I thought about and how it operates, but it's just about the physical plant. But then it dawned on me in my time at the Boston Housing Authority that I am not just a houser, but I'm also I'm concerned about public health. So I've put the two together, since we all know that there are social determinants. There's things called zip code indicators that will tell you your standard of living, your annual income, your level of educational attainment, all of those things based on zip code. And those are the kinds of things that have led to the inequities that we have across this nation today. The pandemic has also, for me, highlighted something that I think I knew but never really spoke about. And that's that it's not just one's physical health that's affected by where you live and how you live. It is also one's mental health. And I see that in property management. One used to talk about when things seem to be going wrong for a lot of residents, a little off rails, we used to say, it must be a full moon. But we never stepped back and really thought about what are the stressors that are on people in our properties that could be affecting what we see outwardly and what those outcomes should be. You've heard people on this panel talk about things that a city needs to consider to affect a comeback. You've heard about resiliency, you've talked about equity, sustainability, and accessibility. And I think those are the same characteristics and the same things that those of us who manage and build and operate housing ought to be thinking about as we build back better. We have to look more broadly at the future of the property and how it's going to be used. Who's going to live in it, for how long, what do they need to be able to do that as independently for as long as possible. And so if we keep those thoughts on top of mind as we design and build, then I think that housing will serve communities much better than currently is done. The pandemic, of course, underscored all the inequities in housing access and in design, and the survivability of affordable housing is still in question because we have not yet come to terms with how we actually can live and improve our properties. I think there should be universal guidelines, for example. When the pandemic sort of ran through a number of my communities in public housing here in Detroit, the benefit of having multifamily dwellings, apartment buildings, is because people could go and isolate in their own units to physically protect themselves, hopefully, from being exposed to the COVID-19. But in so doing, that isolation created other problems with social interaction or lack thereof. And so over time, even before the pandemic, you saw more and more buildings being built, particularly for seniors, that had a variety of community spaces, small little movie theaters, beauty salons and barber shops on site, space for small clinics or people to come in and actually see residents, reading rooms, recreational facilities, and those kinds of things for limited supportive services. And they ranged a whole gamut of both social services for one to be able to live in community and be comfortable, to more recreational and social interaction. I think we need to think about in the future building some significant changes in building design and much smaller ones. The larger ones are ones that will be debated forever because they are much more costly. Access to fresh air. Forget about your ventilation system. Can you open your windows? Can you open them at least enough to get fresh air in? Do you have a balcony that you could go sit on all year round, again, to get fresh air? Or is your building built around an open courtyard or an atrium so that, again, you see fresh air, you get fresh air, you see the daylight, you see outside, you see the green spaces? Those are things that will be debated for a long, long time, but I think we need to think about that in the future. It is also a way to get people outside in a small green space where they can live with the same community of people they share the interior space with, which might then limit any communicable disease transmission. We need to build housing that we've always thought of as for seniors, additional handrails, small benches or shelves outside of each unit for people to put packages on. If you're in an elevator building, whether you've got a small bench or small area to sit and relax waiting for the elevator to come. Those ideas then let people age in place over time and start out in family housing or what's seen as family housing, multiple units, but then are able to remain in place or transfer within the same building, keeping that same community intact. We need to think about adding safety measures like grab bars and transfer bars, doing things that would be more readily adaptable for ADA compliance in those units. Again, so that as people change, they may not be wheelchair bound and need the wheelchair accessibility of a unit, but they may need other supports that help them move around that unit much more easily. We always need to be thinking about building healthy housing, building green, and what does that mean? We need to think more about renewable surfaces, bamboo floors, for example, and not carpet. We need to think about non-off-gassing or low VOC paint. We need to think about how we provide enough use of green building products as well as green materials and supplies to do repairs and to provide cleaning supplies and ventilation in those spaces. Do we have enough air handlers? Is the air exchange in the building appropriate? Are we using high quality air filters? Are we doing regular preventive maintenance? All those things to enhance the livability of the unit. Are we looking at heat levels and all the things that might be respiratory triggers in order to make sure that we are not adding to people's problems and their quality of life and their ability to live as long as possible in our buildings that we are managing and taking care of? We need to think about community spaces. Do we end up having small grocery stores in each building, for example, or in the community or close by? Do we think about building a building that has multi-generational, whether they're 3 separate towers but they share some common space together so that people can see other generations, can interact, and be able to say, we can live in community within our building, and that same kind of just, I guess I would say, diversity exists in the community at large in which that property exists. So accessibility is, for me, 2 things. It's just not how you get into a building, into a unit, which is important, but it's also accessibility in terms of, do you have broadband and internet access? Is a way to get the outside in and get you from inside out as well. Accessibility is also, how do we fund enough affordable housing so that people can live in a place they can afford, that's well managed, where they feel cared for and that they feel that this is a space that they can call home and really take pride in where they live. Equity is also an issue of accessibility. Can everybody who wants to live in a particular neighborhood get in? And if not, can they live in that neighborhood or similar neighborhoods at prices and rents that they can afford? And we've got to think about the longevity of what that costs, what that means for us as a nation. It is and will be expensive, but the question of what's the right thing to do for people who live within the 50 states that we operate in. I think those are fundamental. I think that there's sustainability of a property as well, the quality of design of the construction, the level of affordability. And then there's also sustainability of residents. Do we have stress reducing policies? Do we think about non-smoking in common areas or the entire building? Do we think about, regardless of the source of your income or the amount of income, what that means for your rent? Are we allowing people some flexibilities to pay rent in several installments as opposed to one lump sum every month? Are there other health policies like integrated pest management that we are putting in place, which we know will affect positively people's health? And last all, I would say that there's been a lot of talk about building in communities of opportunity. And what does that mean? How do we make sure that every community has the bones, the good structure, the kinds of institutions that all of us want in our communities? It's the grocery stores, it's good schools, it's places to worship. It is all of that, good public transportation, so that when we get outside of where we live, we are sure that the communities in which we live also support us moving forward. So with that, I'd like to turn back to Cheryl. Thank you.
Thank you. Thank you so much, Ms. Enriquez. This is all really important to think about. And in the 28 minutes we still have, I would like to discuss or hear you all discuss a little more about getting there. And I appreciated very much what Dr. Barbeau said about how we're not yet on the other side of this. There are people acting in some places as if the COVID pandemic is over. And in many of the places where each of you lives and what we've talked about, that is not quite the case. So I'm interested in hearing from whomever wishes to answer, to what extent are public health and housing agencies beginning to figure out how to apply some of these lessons? Do any of you have examples of policies, practices they may have adapted during the pandemic that can help people transition out and maintain better health outcomes?
So I can start and then my colleagues can jump in. To say a couple of things. During the early part of the pandemic here in New York City, we had a partnership between the Public Housing Authority, community-based organizations, whereby the city put on offer free hotel rooms for individuals living in parts of the city where there was ongoing transmission, and they may have had unstable housing, or they may have been in overcrowded housing, as a way to ensure that people could safely isolate and or quarantine. But clearly we didn't have enough. And so I think moving forward, the kinds of changes that Ms. Enriquez is suggesting, I think, are critical.
right? And that's looking at how we change the footprint of development to incorporate not only access to green space, but to access to outdoor space for communal use, as well as ensuring that we don't forget about our elderly in these events, right? Because as this pandemic or any future events, I think all too often from a big picture perspective, we don't necessarily focus on the needs of the elderly or the disabled to the extent that we should from the beginning.
Would anyone else like to address that? Okay. When we
Can I add then one more thing? Because I didn't want to take up too much time, but I want to just sort of build on the idea that Ms. Enriquez also put forth in terms of the aging in place. I think that, you know, we often think about the transmission dynamics of the communicable disease, but I think we also need to think about the care dynamics that occurred as a result of this pandemic, and specifically thinking about nursing home care, and to the degree that moving forward, families will rethink how it is that they want to care for their elders and do it more so in community settings. I think, you know, part of our culture is, I think, to sort of jump to the regulatory issues, jump to the healthcare issues in this situation, when in fact we should be thinking, I think, more globally about how we reimagine the way in which we build our communities to maximize the number of people, be they elderly, be they people with mental health issues, substance abuse issues, that can remain safely in their communities, because that's where, you know, the secret sauce, as I said, of cities lies, and that's how we maintain human connections and we flourish.
So many of the ideas that each of you raised has to do with that simple concept of prioritizing people. And it sounds terrific. To what extent are you able to talk it through with policymakers in your respective cities or fields and move it from idea to at least the beginnings of policy?
So I do think that sometimes I think policy catches up to the innovation. And so I think part of what we all have to think about is that first step. Let's design it the way we want it, and let's see what it's going to cost us, and let's do as much of it as we can, and then turn around and say, we've done it. It makes sense. Here's what we did. Here's why we did it. Let's do a little research around it. What's the baseline when people moved in? Where have they moved a year or 2 or 3 years afterwards? So we've got both the anecdotal and the statistical to really make a powerful statement about why this is appropriate. And I think doing that the policymakers will have a sort of aha moment and begin to think that maybe there are universal design issues, that there are some cost benefits, and people will then be forced to think about, how do we do this in an economical but yet full way so that we are having the best outcomes for people who live in our communities.
And just to pick up on that, I mean, you never want to think of pestilence as making way for opportunity, but we are in this very opportunity-rich moment in that pre-COVID, health was so synonymous with healthcare, and post-COVID, people are really understanding the intersectionality of all of these issues. And so I think it actually makes it easier to have this conversation with policymakers, because now where they maybe didn't get the relationship to certain issues, they fully understand it. And so I think we need to capitalize on that moment and talk about, present to them both the anecdotes as well as some of the data points that Dr. Enriquez just mentioned on all of the issues that we've raised today about how to come back stronger. So.
Yes, I was thinking about, where the data may be coming from and how institutions like the schools of public health are very well positioned to present some of that, even though the pandemic continues, the studies have begun. And I'm wondering if any of you have been able to be in conversation with, I think of you, Ms. Forrest, about city, city public health officers, mayors, legislative aides, or government relations people, about how to move some of these ideas forward. And I'd be very happy if those of you in academia might also jump in, and you as well, Ms. Enriquez. How is some of the data being presented to bolster the anecdotes?
I mean, well, I'll say that under Dr. Barbeau's leadership, and this is actually true for the Department of Health in New York City in general, and I know it's true in Boston as well, the Department of Health was not only collecting the data, but also making it publicly available. And, it literally is the basis for a lot of the analysis that's being done by academics. And I always, kind of include their charts. So they're not only, you have access to the raw data, and you have access to some of their summary figures and things like that. And so that's very helpful. I think that there's also been, kind of a clear connection between relying on the expertise of researchers, for instance, in academic institutions, but in clear partnership with, city agencies, and obviously the departments of health are clear partners in that, and not just in the context of COVID, but I think for other initiatives as well. I think about the work that's being done in public housing, and there's literally a liaison between public housing and the Department of Health here. I'm almost certain that that's also true in Boston. And so there's also the interagency collaborations, which I think also help to kind of, translate what's understood in one domain, so in public health, for instance, into the housing domain. And that is helpful. But people are really interested in impact. And I think that that's where those partnerships with researchers is very important, because from an evaluation perspective, people want to know whether or not the policies that have been implemented actually are effective, and to what extent they're effective. And so, that is also, I think, more entrenched in not just how partnerships are created, but also how funding is being allocated these days for thinking about like real world and kind of grounded research.
Can I build on what Dr. Hernandez just laid out? Because I think I appreciate her acknowledging the role that public health departments, not just in New York, but in other places, have in making data available. And I will say, I think it's important to sort of tease out what I think about as short-term data and long-term data. And COVID was an example of how across the country, we need to do a better job about making data available faster for decision-making, right? And so that speaks to the sclerotic nature, if you will, of government. And I speak as a former government official. And so that's one issue, right? We need to get better at making that available. Two is we need to get better at using data from community sources, right? And creating systems where we can help community organizations collect data in a way that is useful both for their purposes as well as for government purposes. And then lastly, the thing that I will say is, COVID has demonstrated that the consequences of not collecting accurate and complete information on race and ethnicity, right? The fact that CDC still has 43% of their data on people who've been vaccinated doesn't have race and ethnicity, I think is a national shame. And it's no disservice to the CDC, it's to the states that have to report this data, right? So why is it that all 50 states can't report on race and ethnicity? And then while I'm on the federal government, I think we also need to pay attention to government agencies like HUD, right? HUD a number of years ago, I think removed, and Ms. Enriquez, you can speak more to this, but eliminated the requirement to report on race and ethnicity. And so when we think about the intersectional, issues that we're trying to move forward in terms of having sustainable and vital cities, I think it's important for that to be collected across all domains.
Several of you spoke to the kind of opportunities that abound in this moment. And I know that everyone present is thinking about, okay, how do we take advantage of these opportunities? How do we pool knowledge? And this conversation is a great example of it. I also very much want to address some of the questions that people have been sharing. And some of them have to do with the cost. I mean, there are a couple in the chat about how all the programs seem doable, how to implement them. And one person in central New Jersey particularly was talking about how what is built for elders is so often not affordable for them. And so how this process of building back better is something cities can afford.
I would like to say that affordability is always critical in any housing situation. So if you can afford $5,000 a month for rent and you find a place, that's great. If you can afford only $50 a month for rent, you're going to have a really hard time. And you're going to have a hard time because, and I'm not against property owners being able to meet their mortgages, pay their property taxes, insurance, and all that stuff, and even make a little profit on the side. I'm not against that at all. Number one, that's number one. Number two, I've always said, I mean it in a very nice way, that poor people are expensive. And they're expensive because we collectively take advantage, I would say, of poor people in the ways that we make some decisions about budget. The poorer you are, the more dependent you are upon public health, our health clinics, public transportation, public education, I mean, you name it. And those are all the things that you have the hardest time influencing. So you sit here and you want to do better. It's very hard. And so you do come to rely on trying to look for something affordable. And so you've got this sort of tension between a property owner who wants to make back at least his or her costs on developing the property and maintaining it, and knows to the penny how much that's going to cost in rent that he's got to or she's got to charge every single month for every unit. And then that number, more likely than not, does not match the number of someone's ability to pay. And so where do you find, how do you bridge that gap? And obviously you bridge that gap through some sort of rental assistance or subsidy program, which then you need to figure out who's paying it, how it's sustained, and of course, as you budget year over year, where do you cut? Because it becomes a very expensive proposition. Right now, about 1 in 5 people, families in the United States who need a deeply affordable housing can find it. That means that the other families are paying significantly more than they can afford. That's a mental health issue. It's truly a stressor. It affects everything they do, where they work, where their kids go to school, how they get there. You can see that it's just this repetitive cycle, and we're going to have to figure out how to break that cycle and make a commitment, whether it's a moral obligation or however one sees it as a good business decision. We've got to figure out how to keep this going. And right now, universal housing vouchers are being considered by a lot of housing groups on the national level. I've not seen any costs put against that, but at least people are beginning to think about the right to an affordable place to live. And I think we've got to push that conversation as hard and as fast as we possibly can.
It reminds me of the idea of breaking down the silos between agencies and policymakers that we referred to earlier. We've got room for maybe a couple more. If everyone can't get their question answered, please know that we appreciate them. Yes, Dr. Barbeau.
I just want to build on what Ms. Enriquez said at the end, because I think it's an important opportunity for us to remind the audience and ourselves that COVID has been a time where previous rules and regulations were by and large suspended to serve people. And as we emerge from COVID, it's an opportunity for us to interrogate those rules and regulations to really see if they serve people or if they serve to keep people down, right? And so as an example, cities across the country are rightly getting tons of money from the federal government. My hope would be that a lot of them would put money towards rent relief for people and subsidize people in the most basic way, which is obviously housing.
One of the questions in the chat addresses something that sounds a little to me like incentivizing the vaccine, offering lotteries and such. And I recognize that offering medals to cities in the 40 that City Health monitors is not quite the same as that, but how does that engagement take place? Somebody in the audience would like to know, how do you determine?
I'm sorry, is this a question of how do we determine the cities, or is it a question of
what the medals are? Someone was seeking a bit more clarity on how you gauge that the cities are meeting all the measurements.
Gotcha. So in selecting the policies that we add to our package, we develop criteria, and the criteria is developed in partnership with subject matter experts, with local officials, and we look at the evidence base. And so that is how we then assess those cities. We have pulled together sort of the best practices under each of these policy categories. And we have a process called legal epidemiology, where we work with a team of lawyers who go into city codes to see, did they actually hit all of these metrics? And if they did, they are eligible to receive a medal. If they didn't, again, we support them. So we are happy to say, let us provide you some technical assistance or some model policy language to help you get over the finish line to be able to earn a medal. But one of the things that I will say about medaling too is that we've found it to be highly motivating for cities. It is a carrot. And so it's very motivating, but it also fosters this kind of competition where, let's say you're in a state like Texas, if you're in San Antonio and you have a gold medal, your sister city over in El Paso or Fort Worth might say, hey, wait a minute, they were able to do something that we weren't able to do. So let us contact City Health and figure out how we can also adopt these very strong public health policies.
And they're contacting one another also, I trust?
I hope so. I mean, we facilitate that in some of our policy areas where there is this sort of cross-sector learning, because I do think it matters to city officials that they can speak to each other about their unique experiences and how they can implement policies with fidelity in their respective jurisdictions.
Fascinating. We could talk a long time and listen to one another for a long time. I want to note that the entire conversation and presentation has been recorded. So if you know of people who might be interested, please refer them to this site. And I really want to thank each of you who've taken the time and expertise to share with all of us. Dr. Barbeau, Ms. Forrest, Dr. Hernandez, and Ms. Enriquez, thank you so much. I'm learning a lot. I hope that all of you in our audience are also learning and can spread what you've picked up here and keep talking with one another, because we're not out of this pandemic yet. And it's shown us so much about what needs to be done. So it's a good time to jump back into it. And I'm going to allow the Galea to offer the benediction.
Thank you. You know, Cheryl, I often say that this is a benediction, so you read my mind.
We've never met. Okay.
We've never met, and that's exactly what I normally say. Let me just say, echo, first of all, Ms. Deval's thank you to Ms. Enriquez and Ms. Forrest and Drs. Barbeau and Hernandez. I really thank you all. Thank you, Cheryl, Sandra, Diana, Auxiliaries, and Katrina. It is a rare privilege to be involved in a conversation where you're like, I am just learning so much from everybody. I just thought it was really fabulous. And what is to me is most remarkable about this topic is how much potential it has. You know, I'm often asked by young scholars, usually in their training, you know, what should I be doing? And this is one of those areas which I just feel is really has such an opportunity for somebody who wants to engage with it for the next many decades, because fundamentally what we do with our cities shapes the health of the majority of us. And it really is, it is such a rich area, right? There's now a global conversation at the World Health Organization level about how we build cities and rebuild cities in the context of COVID. There's just a tremendous momentum in this. And I think for everybody in the audience, you heard some of these strands and you heard some of these ideas. And in many respects, perhaps the hallmark of a good conversation is that it raised more questions than it answered. And it's exactly what a conversation like this should do. Thank you to the audience. We are aware it's actually July 1st. I don't think we've ever done an event on July 1st, and that we had more than 200 people engaged in July 1st, which I think is a testament to how interesting this topic is. I want to say thank you to everybody in the audience and for excellent questions. To everybody, I hope everybody has a wonderful summer. Everybody has a break in the summer, and thank you to everybody for everything you do for the public's health.